In the last 2 lessons, we looked at the CSH framework for sleep evaluation and then workup, including basic screening labs and rating scales. But what are some things that you can recommend right away to help your patients with sleep while you're doing a workup and evaluation? Today, we're looking at 3 things to recommend to your patients to get quick wins to help them sleep better. If you're a physician who wants to uplevel your sleep medicine knowledge, then go ahead and subscribe to this channel. Doing so helps to feed the YouTube algorithm to get this information out to more people, which really helps a small channel like mine. This channel is all about really practical, clinical sleep tips that you can use in your outpatient practice, because most of us only get about 2 hours of sleep education during medical school, but all of our patients have to sleep. So this channel is for physicians of all backgrounds, primary care physicians, psychiatrists, therapists, and any healthcare practitioners who are working with patients who ever struggle with sleep issues. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. Every video is eligible for CME credits, so watch all the way to the end and then grab your free CME credit. The link is in the video description underneath. And then if you find this information helpful, please share it with another doctor or clinician in your life who could benefit. A quick disclaimer, the information that I'm presenting is information only and is not medical advice. Okay, today we're talking about 3 quick wins to get with your patient. And why do we want to get quick wins? If we can provide our patient with a little bit of rapid relief with tools that they can implement right away, it's going to help build trust with your patient, it's going to help build rapport, and ultimately what we're going for is to help your patient build their sleep confidence. Oftentimes when people are struggling with sleep, they start to lose confidence in their ability to sleep, and we really want to restore that. Helping them get some quick wins is going to get them on that road to building their sleep confidence. What I tell patients is that doing these simple things isn't necessarily going to change their sleep overnight. In some cases it can, I have seen that happen, but generally it's going to take time and it's going to take multiple tweaks over time to really make a substantial impact. But what we're going for is 10% incremental improvements. So I talk to patients about, can we make things 10% better? And then can we add to that and go from there? The first quick win is optimizing the bedroom. Now, this isn't one that we often talk to patients about, but it's really important. You can imagine that the environment that the person is sleeping in is going to impact their sleep. Now with telehealth, many of us are seeing patients on Zoom. I see all of my patients on Zoom. You can get a little bit nosy and you can actually ask to see where they're sleeping. So you can get a real visual of what their sleeping environment looks like. If you're not seeing them on Zoom or you're not able to get a visual of their bedroom, you can ask them about their bedroom and get a sense of how their sleeping environment might be affecting their sleep quality. Now there's this framework that I have come up with that I like to use to help patients optimize their bedroom, and that is the 3CD framework. This stands for clean, calming, cool, and dark. So those are 4 principles that you can use to help your patient improve their bedroom. And so let's unpack that a little bit more. I'll share a couple of quick stories. One is of a patient of mine who was struggling with sleep for many years, and she'd seen different sleep doctors, psychiatrists, primary care physicians. She'd been prescribed trazodone and other sleep aids. She came to see me, and one of the first things I like to do is ask about their bedroom. And it turned out that she was sleeping in a tiny little unventilated, dingy closet in her studio apartment, because it was the only separate room in her studio apartment. So she turned it into a bedroom, but she literally could not breathe in there. It was dark, dingy, dusty, and depressing. No wonder she couldn't sleep. So I had her move her bed out of that closet into a more ventilated area in her studio apartment, and she set up a little screen and created this nice cozy area by the window, and she could breathe easy at night. And literally her sleep improved just with that one change. There were other things going on with this patient as well that we were able to work on over time, but this illustrates how impactful it is to investigate where the patient is sleeping and to see what changes can be made. Another patient of mine has been struggling with sleep for many years. I was seeing him on Zoom and I asked him to show me where he sleeps, and he showed me this cramped area where the bed was pushed up against a wall. He had to literally climb over his partner in order to get into the bed, and then he was squished up against this wall and he couldn't move, and he dreaded going to bed because of it, because it was just so cumbersome and uncomfortable to sleep there. And again, we made some changes. We figured out some creative ways to rearrange the room a little bit to give him more space, and he did that, and he no longer started to dread bedtime. That was his main complaint, was difficulty falling asleep. Now bedtime was this welcome event. It was much more comfortable, and this is another situation where slightly changing the sleeping environment can have a big impact. Again, it wasn't as simple as that. There was other things going on with this patient that we worked on, but this is an important aspect that we often miss. And lastly, just a personal story. When I used to live in Chicago, we lived in this large loft and there was light streaming in through the windows. We lived downtown across from the Sears Tower, and then there was noise from the highway, and there were streetlights, and I didn't think too much about it. It was just how it was. We had blackout curtains. But then when I moved to California in a more forested area, suddenly it was dark at night and it was quiet. But the darkness really struck me, and I noticed that my sleep just seemed to be deeper as a result. So this is how light can really impact your patient's sleep. Okay, so as far as bedroom optimization, these are really tangible, actionable things that you can recommend to your patient, and patients respond well to that, right? Because these are things that they can actually do. Often when people are struggling with sleep, it feels so murky and it feels so out of control and intangible that actually working on their bedroom feels like something that is in their control. They can actually get their hands dirty, literally, and do something about it. We want to create an environment that is calming, that's peaceful, that's going to activate their parasympathetic nervous system, that's going to be a sanctuary that people look forward to going to. And by regulating the light and dark exposure in the room, we're also going to help regulate their circadian rhythm. So there are a lot of different aspects to this. Some simple actions that you can recommend to your patients are to remove clutter. Removing clutter helps to activate the parasympathetic nervous system because seeing clutter all over the place is like a visual to-do list. It reminds the patient of all the things they have to do. I have to do my laundry. I have to return that thing to TJ Maxx, and it just activates their nervous system. There was actually a study from 2017 showing that removing clutter from the bedroom helped to increase sleep quality. And they proposed that decluttering the bedroom should be a part of general sleep hygiene recommendations. Removing clutter also allows the patient to breathe better. When there's lots of clutter, there's more dust, and that can particularly impact people who have allergies or asthma or other breathing difficulties. Vacuuming and dusting surfaces can have an impact on the patient's breathing quality at night. You want to think about ventilation. Can the person open up their windows and get some air circulation so it's not stuffy in the bedroom? Of course, temperature regulation is really important. It's thought that the optimal bedroom temperature is around 65 degrees Fahrenheit or 18 degrees Celsius. There's going to be variability in that. It's going to depend on the person's comfort level. Some people prefer it a bit warmer, some people prefer it a bit cooler, but generally in that range is what is recommended because cooling of the core body temperature is an important aspect of sleep onset and maintenance. And then I encourage patients to have fun with decor. They can use colors that they like, they can get a bit creative with it, creating a cozy environment that is to their taste, that they enjoy going to at the end of the day. It's an important aspect of the sleep ritual. Quick win number 1 was optimizing the bedroom. Quick win number 2 is mild sleep restriction. An important distinction is that sleep restriction is not actually about restricting sleep. It's a little bit of a misnomer. What we're actually doing is restricting the amount of time that is being spent in bed. When people are struggling with insomnia, there's a tendency to spend more time in bed hoping that they're going to get more sleep, but it's actually counterproductive. By reducing the amount of time in bed, the more we're going to increase the sleep drive and consolidate the person's sleep so they get better sleep quality. We're also reducing the association of lying in bed, awake, and being anxious and frustrated. The more a person does that, the more it trains the brain to be awake and anxious in bed. We want to break that association by reducing the amount of time in bed closer to the amount of time that they are sleeping. Now, when I say mild sleep restriction, there is actually a sleep restriction protocol that is part of CBTI or cognitive behavioral therapy for insomnia, but I'm not talking about that right now. I'm just saying slightly restricting the amount of time in bed. If the person does need CBTI, if you refer them for that, then they would go through the full sleep restriction protocol. Sleep restriction increases sleep efficiency, which is the percentage of time asleep compared to the amount of time in bed. We're aiming for a sleep efficiency of about 85%. It reduces sleep latency, which is the amount of time it takes to fall asleep. Sleep restriction also reduces nighttime awakenings by consolidating sleep, and it's shown to increase the depth and duration of sleep. Here are some general tips to implement mild sleep restriction with your patients. One is to tell them to spend less time in bed. They shouldn't be working in bed, whether they're on their laptop or checking emails, or maybe they're a student and they're doing their homework. All of those things should be done out of the bed. And I've even had patients do creative things like set up a small desk that they can put on the floor or a beanbag chair or things like this so they can work outside of their bed, especially for people who are like college students and they don't have a lot of space. Another tip is to go to bed when sleepy. You may be surprised how many people go to bed at a fixed time thinking, okay, it's 10 p.m. and I have to go to sleep right now, even though they're not sleepy yet. And that can start to train their brain to be awake in bed. Sometimes delaying bedtime to when they actually feel sleepy, when their eyes are heavy and they're ready to fall asleep, can help with this mild sleep restriction, particularly for your patients who have sleep onset issues. We don't want to force a bedtime. Naps can be very helpful, but for people who are struggling with sleep, particularly insomnia, naps could be counterproductive. productive. If you're a healthcare practitioner, I would love to invite you to my free upcoming sleep masterclass. It's on 5 sleep supplements to use in your clinical practice. It's taking place on 3 different dates, February 13th, 14th, and 21st in 2024. You can go to the link there and sign up. It's totally free. And I'm going to be talking about 5 different sleep supplements that I recommend. And I'll also be opening doors to my sleep program. You'll be able to join me and ask questions about the program in case you're interested in that. So I'd love to see you there at the masterclass. Quick win number 3 is to maintain a consistent wake time. Waking up consistently at the same time daily is associated with better health outcomes. It helps to reduce social jet lag, which is just like the jet lag we get when we're traveling. For example, if you're traveling from San Francisco to New York, that's a 3-hour time difference. If you wake up 3 hours later on weekends compared to weekdays, that's just like jet lag. There's a time difference without actually going anywhere. It induces a jet lag-like effect that we call social jet lag. Maintaining a consistent wake time also helps to reduce sleep inertia, which is that feeling of heaviness and grogginess and general inertia in the morning. A consistent wake time is also associated with reduced symptoms of insomnia. Here's a study that was recently published on the benefits of a consistent sleep schedule. And in this study, it was found that maintaining consistency with the sleep schedule is associated with a 30% lower mortality risk, 38% lower cardiometabolic mortality risk, and the conclusion was that sleep consistency is a more important factor for overall health than sleep duration. I'll say that again. The consistency of a person's sleep schedule is more important for their health than the amount of sleep that they're getting. That was the conclusion from this study. Here are some tips to help your patient maintain a consistent wake time. The first step is to choose a consistent wake time that works for their lifestyle and their schedule. Sometimes people might not be able to adhere to that right away. It might take them some time to work towards that consistency, but setting a goal to work towards is a good first step. Avoid hitting the snooze button multiple times. I'll see patients who need to wake up at 7 a.m., for example, and they know it's going to take them a while to wake up, so they might set their alarm for 5:45 or 6 a.m., and then they're hitting their snooze button for an hour or longer before they have to get up. Then what happens is they're actually disrupting that hour or so of sleep that they could be getting before they have to wake up. So tightening up that snooze time so that it's not quite as long can help with this consistent wake time and actually help the person get a little bit more sleep. You want to anchor that consistent wake time with morning bright light. If your patients can go outside and get bright sunlight without sunglasses, without a hat obstructing their sun exposure, going for a walk is great. So this is going to help anchor their circadian rhythm and help with alertness. Also, they can get a little bit of exercise this way. For people where that is not possible, then a light therapy device can also be helpful, especially if they're waking up before the sun comes up. And I recommend to patients to be patient, have some self-compassion through this process, because if they're used to having really irregular sleep times, especially on weekends versus work days, I see this a lot with the younger adult population, it can be really challenging to stick to a consistent wake time. So have a little bit of patience, you have to be a little bit persistent, have some self-compassion around it. That is going to help you achieve your goal. Those were our 3 quick wins to help your patients sleep better, optimize the bedroom, spend less time in bed, and maintain a consistent wake time. Which of these will you start implementing with your patients? Are you already using any of these with your patients? I would love to hear from you. Let me know in the comments. If you're a physician who wants to up-level your sleep medicine knowledge, then go ahead and subscribe to this channel. Doing so helps to feed the YouTube algorithm to get this information out to more people, which really helps a small channel like mine. This channel is all about really practical, clinical sleep tips that you can use in your outpatient practice.